Today, I'm joined by Dr. Claude-Bernard Iliou, a remarkable medical educator with an extraordinary breadth of experience across multiple continents. After completing his undergraduate studies at MIT and conducting receptor research at Harvard MGH, Dr. Iliou pursued clinical training in anesthesiology and pain medicine before ultimately finding his passion in medical education. His journey to academia took a decisive turn following the 2010 Haiti earthquakes, where he transitioned from teaching in Haiti to joining St. James School of Medicine in the Caribbean. There, he's risen to a top leadership position where he oversees academics, finances, and accreditation while maintaining his passion for teaching. What makes Dr. Iliou particularly unique is his experience teaching virtually every subject in the medical curriculum at some point, giving him rare insight into how these disciplines connect and where students struggle most. This comprehensive perspective informs his systems-based approach to preparing students for the USMLE preparations. Welcome to the podcast, Dr. Iliou.
Thank you for having.
So, how did you end up in medical education in the first place as the dean of one of at St. James?
Well, I got into medical education while I was in Haiti, and I taught at several different schools, and I started to have leadership and administrative roles, medical director for continuing medical education, and working with the Institute of Human Virology from the University of Maryland. And so that really was my introduction into academics. And then after the earthquake, I went back to the United States and started looking into different careers and different positions. And this school, St. James, just opened their Aquila campus in 2010, and that's when I joined. And so I joined as a professor, and shortly afterwards I became the.
Tell us more about what it was like to live through the devastation in Haiti.
That was something. I hope never to see that again. And even to this day, sometimes earthquakes, gets my blood pressure up and my heart rate up. It really was huge devastation. I'd never seen anything like this. You can see the videos, but it really doesn't do it justice. When the earthquake happened, I had just pulled into one of the medical schools I was teaching at, and I saw buildings start to get destroyed and come down, and there was a large slum area right around the school that had buildings that were not up to code, and so those all fell apart with the massive earthquake. And so I had created with the students a triage in the parking lot and was helping to get injured individuals out of the surrounding buildings so that we could give them the first aid.
Wow, I can only imagine what that would have been like. So what was going through your mind like at that moment? Like uh, was there any sort of warning sort of beforehand?
No warning whatsoever. And at first, when my car started to bounce up and down, I was still in the car texting. My car started bouncing up and down. I thought it was some kind of prank, one of the students maybe jumping on my rear bumper or something that was doing that. And then I looked up and I started to see all the dust and these buildings collapsing. And that's when I realized, oh my God, this is something serious. And then I thought, there are students in the school behind me. I need to get them out. So I got out of my car, ran in, tried to get everybody safely out of the building into the parking lot to serve as a muster station, and make sure that nobody was left in there or was trapped. So that was very, very important. And the whole time when we were providing first aid to injured individuals, I thought that my house was perfectly safe, right? And it wasn't until after dark and we had started transporting these patients to the hospital that I went back home and I saw that my house had also collapsed. And so I was concerned. I was like, oh, I hope there's nobody in there when the house collapsed. But luckily, nobody was injured at my house. There was no.
What happened to the hospital at that time?
Well, there were some hospitals that that did collapse, but the um, the main hospital, the general hospital, was functioning, and it was a one-story building, so it really did not have any weight on top of it that would cause it to collapse. So it survived. But there were a number of hospitals that were multi-story structures that that collapsed from the earthquake.
What's the thing that you'll remember most from that experience?
There was um, there was a hospital, probably 6 stories or 7-story hospital, right down the street from my house. And the hospital was in the process of being built, but the first 2 floors already had patients in there being treated, hospital beds, nursing, equipment, etc. And the upper stories were in the process of being finished, the walls, the tiles, etc. And that whole thing collapsed entirely, like pancaked. And starting about 2 days afterwards, the smell from the dead people that were in there, and there was nobody to start to clear it out or try to find survivors. Uh, that was quite a situation.
Wow, that must have been very devastating. And so, so walk us through what happened next in your career. So where did you go from there?
Oh, after that, I went back to the States, and and then I decided that I really enjoyed teaching and I wanted to continue my academic career. So I started to apply to various medical schools and interviewed a few, and ultimately ended up in Anguilla teaching at St. James School of Medicine. So I was teaching pharmacology and neuroscience, but then after I became dean, it became necessary for me to cover other courses over time. So I have a pretty long career there, and certainly did a lot of teaching and for various courses, basic science courses.
You've taught almost every single subject for sort of the preclinical sciences. What's sort of the subject that you find students struggle with the most?
Yeah, well, I would say number one is physiology, and that is such an important course. Not only because it sets up as a basis for pathology and for pharmacology, but it really is the basis for a lot of medicine. And if you don't understand the physiology, you're going to have a difficult time. So I see a lot of students who do poorly in physiology and then they end up doing poorly in pharm and in path because they don't understand some of the basics. So I think that that's a very important course that, you really have to have a solid basis in order to be able to appreciate the rest of medicine.
Makes sense. Yeah. I mean, to have that solid foundation, I mean, everything builds on sort of like how does the body work in the first place? Pharmacology, pathology, everything builds on that. What are the, I always like to invert things, meaning like, what would it take to just sort of fail at something and then just do the opposite of that in order to figure out how to be successful? What are the things that you find for students that really struggle with physiology? Like, what are they doing wrong?
Well, I don't know about schools in general, but certainly for the Caribbean schools, and especially for the ones that I've taught at, the most important thing having is not going into the lectures cold, you know, having some preparation for the lectures, reading up on the chapter, looking in maybe a review book, or looking at the slides or watching some videos so that you have a general idea of what is going to be covered in that lecture. And you've had an opportunity to look up words that you don't know, because, medicine is like learning a whole new language, right? So there'll be a lot of words that and terms that you may not be familiar with. And if you're coming into the lecture cold, that makes it difficult to really absorb all that there is. I like to tell my students that, you come into the lecture cold, you may absorb 10%, right? But if you come in and you've prepared for the lecture, you've read up, you've watched videos, you've looked up words, you may not absorb 100%, but you're probably in the 50+% of what is covered, you've have absorbed, right? And so now you're in a much better position. You can then review what you highlighted, what the professor thought was important, what was considered high yield, and then be able to do some questions to test your knowledge and see if your understanding is sufficient enough to use that material to answer questions, right? So that is important to prepare for that. And also, if you go into the lecture cold, you don't even know what questions to ask because you're nothing to compare it to. If you have prepared for the lecture, then you have an opportunity that as the lecturer explains something that's not exactly what you understood, you can ask questions to clarify, ask them pointed questions for clarifications that you wouldn't even know to ask if you had gone into the lecture cold.
So it's like you've got like kind of the pre-work, the intra lecture work, and like the post lecture sort of questions. How would you, if you had to apportion your time, like what have you found is sort of the optimal balance in terms of time?
For students, for it, and this is the thing, is I believe that students should not treat all courses the same. Okay, I think it's a mistake to treat all courses the same because there are certain courses that are mostly concepts. The object of the course is to master those concepts. If you master those concepts and you're able to use those concepts to answer questions, then you're going to do well on any assessment that relates to that. And the courses that are mostly concepts, once you've absorbed the concepts, it sticks with you for a very long time. Months later, you'll be able to use your understanding of the concepts to answer questions. But other courses have a lot of material that you just have to memorize. Yes, there may be a little bit of concepts, but a lot of memorization too. And that you approach differently because the material you have to memorize doesn't stick with you for very long, right? So it is advantageous to organize that material so that you could review it and review it and review it and review it right before your assessments. You have a quiz, you review it the day or 2 days before the quiz, just to remember. You'll hold on to it long enough to use on the quiz, but you may forget it a week later, but then you have it organized in notes, in flashcards. I like tables particularly because it allows you to associate terms with presentations, with disease processes or mechanisms. And so that usually is the form of how the assessments present themselves on examinations that will allow you to be able to ask questions.
What are some examples of these more conceptual based things where you can really just focus on the concepts and understand them and sort of it makes retention easier versus like the more detail based ones where you're going to have to really stay on top of the retention.
Right. So a classic example, some feedback mechanisms, right? The fact that when your angiotensin level, angiotensin 2 goes up, the feedback inhibits renin, right? So that's a constant, right? Your increase in blood pressure will cause a decrease in heart rate, right? So these are concepts, right? And so when you understand those concepts and you've used it to answer a couple of questions on exams or practice questions, you really feel confident that if you see that kind of a question again or a question on the same topic, you're going to be able to answer appropriately, okay, because you pretty much mastered the nonsense. But on the other hand, something that is memorization, like the translocations, 15, 17 translocation, causing leukemias or lymphomas, that is something you have to memorize. That's not really a concept. Yes, maybe there are certain findings that you have to associate, like hour rods, you don't want to associate with AML, and certain translocations. And so a table is an efficient way to present that and to create a table that has all of the translocations and their associated leukemias or lymphomas and their associated maybe clinical findings or presentations or demographics. This occurs in a 60-year-old male. This is more likely to occur in a 5 to 10-year-old child. You associate these together in a table, and that allows you to prepare the information and organize it so that you can review it efficiently and hold on to it for a couple of days so you can use it on the exam. And you still have your table in case you forget which translocation is associated with which beauty.
So I think what I'm understanding is that if you can, try to make sense of it, right? Like try to bring it back to some concept because concepts are sort of interdisciplinary, right? If I understand sort of feedback mechanisms for RAS, I'll understand feedback mechanisms for the baroreceptor reflex, I'll understand feedback mechanisms for endocrine and a variety of different things. It will help me remember it better, it'll help me use it better. But if I can't make sense of it, at a minimum, I still have to know it. Right? There are certain things that I just have to know, and so those details, at a minimum, I can use things like tables or other things to try to help me just sort of keep it in my brain. Is that right?
Yeah, that's exactly right. And just as an example, the lysosomal storage diseases or the glycogen storage diseases, those you have to know the name of the disease, the enzyme that is deficient, the presenting symptoms, right? Because that's how the questions are worded on standardized exams. And you may know the name of the disease and what enzyme, but if you don't know the presenting symptoms, you're going to get the diagnosis wrong and you're going to get the answer wrong, right? Or you may know the name of the disease and some of the symptoms, but if you can't remember the enzyme that is missing or that is mutated, then you may not be able to answer the question, right? And so these kinds of things, if you can manage to make sense of it as a concept, wonderful. But most students, this is something that they have to memorize. And so they need an efficient way to memorize it and to associate the name of the disease, the enzyme deficiency, the presenting symptoms, other findings, so that when they see a vignette that includes that, they'll be able to make the right connections and get to the right answer.
What are the things, so speaking of standardized exams, what are the things that you've seen have helped or hurt students the most in preparing for standardized exams?
Well, one of the things that I think is important, and maybe this isn't something that's available at all schools, but I believe that it's important for the student to go back and look at their answers that they had on the exam. Like review the exam if the school allows them to, because sometimes they have preconceived notions of what the right answer is. Maybe it was from studying, or maybe they did a question on a practice question on a question bank that was miskeyed, or they made a wrong assumption, a wrong association, and it's stuck in their head. And whenever they see a question that's like that, they know that the answer is this, and never testing to see really that it may be a different answer. And so, having the opportunity to review your uh, exams is really important. And so I tell students to do that. It's an important thing to do. And some of them, I would say, for most of the students I see, no more than 10-15% of the class will repeat. And that is such a shame, because that means that there's a huge number of students that may continue to have this uh, incorrect assumption about what the right answer is, or what the right concept is. And
I appreciate you sharing that advice. We have found something very, very similar. I we had a student recently who her first score was like a 200 on her step two practice exams. We go over every single practice exam with students when we're working one-on-one with them. And the reason that we do that is exactly what it is that you said. It's to see the patterns of the mistakes that they're making. And what we find is that, oftentimes they don't even see the mistakes that they're making. Some of them are knowledge, right? Maybe 50%, but 50% are typically sort of like cognitive errors. And just by pointing out the cognitive errors, just by helping her sort of like fix them, she improved by like 45 points in 3 weeks. Her knowledge improved marginally, but it was exactly what it is that you said, right? It was how can it's like seeing the patterns.
yeah, so test taking skills is extremely important. And, for most students who have been doing multiple choice questions for years in college or at other institutions, they think that they know everything that there is about how to dissect a vignette and answer the multiple choice question. But for medical school, it's like a whole new level. And the difficulty level and the way that the questions are worded, and multiple choice questions are worded, in other institutions and in undergraduate, are very different than what we see in standardized exams that are for medical education. And so, honing your skill at how to approach a clinical vignette, how to extract the relevant information from that vignette, and be able to use that to answer the question is extremely important. And sometimes the students are not adequately prepared for that. And for some students, especially the students that, an undergraduate, their assessments were essays or short answer, those students are probably not prepared adequately for the kinds of vignette style multiple choice questions that they see. And so as a result, we do see that spending some time with students and honing those test taking skills does turn out to improve their scores without any necessary increase in knowledge, right? Being able to do that is key, and is very important for them to maximize their points. There's nothing more frustrating than a student who has spent hours and hours studying, takes the assessments, and then does not perform to the level that they of their knowledge, because they are unprepared for how to answer multiple choice questions.
What have you found is the biggest sort of barrier to students being able to analyze questions effectively?
Um, it depends on the student, but I think that many students try to read the vignette too quickly, because there's a time factor, right? They have, for standardized exams in medical education, they have 90 seconds to read the vignette, analyze the facts, and answer the question. And although that 90 seconds is sufficient for most questions. There are questions that require more time. The ones that require you to do math or to analyze a CT scan or analyze table or a graph sometimes may require longer time to do it. And so students have this natural fear of running out of time, so they tend to scan questions quickly, not read everything thoroughly, and then get to the answers and rely on the fact that they're given choices and then just eliminate the choice rather than understanding what the question is asking and formulating an answer without even getting to the various choices, right? Sometimes you have to use the choices to eliminate to get the right answer, but that should not be your modus operandi, right? You use that when nothing else works or all else fails. But I see that students are using that as their main mechanism of answering the question, rather than reading the question, identifying what the question is asking, and then coming up with the answer.
Yeah, it's like the slow is fast. Make sure that you really understand what the vignette is saying. Make sure that you really understand what the question's asking, because we see the same thing. If you don't understand what each sentence means, and especially if you don't know what they're asking you, like your chance of getting that question correct is almost zero. Like there's very little chance.
Absolutely. And what happens is when you read it quickly, and then you get to it, and you're like, "What is this question? I don't understand." What happens? You end up having to reread it again, right? And so you're wasting more time having to read that the second time or the third time because you didn't spend enough time reading it properly the first time. And for example, with a standardized exam question, they give you information. Demographics is key. They give you the appropriate age, the appropriate sex, if necessary, or gender, the appropriate race sometimes, right? Uh, that is associated with that disease, right? And also the length of time will tell you whether it's a chronic condition, it's an acute condition, it's a subacute condition, and that also helps you to get to the right answer because you can eliminate the ones that do not correlate with the time sequence of a particular disease, right? So all of these you have to be cognizant when you're reading the question. Okay, so this is a woman, she's in her 50s. This is a chronic condition, she's had this for a while, right? So these help you to eliminate some of the distractors in the question. But a lot more importantly, they also help you focus as to what the disease is most likely to be.
That's brilliant. Yeah, we've had, and to your earlier points, right, to kind of put your advice sort of together. We had a student who had failed step one, who like was so unmotivated because his effort wasn't matching his scores, like couldn't get out of bed. All we did was to help him to change the way that he learned, right? So exactly doing what you suggest, right? Putting things together conceptually, making sense of it, and then changing the way that he was reading questions. He improved his score by something like, he went from the equivalent of failing to a 262, which is like bottom 3% to top 3% in about 2 months. Because he was now motivated, he was seeing results, and ended up obviously passing step one and just matched into urology this past year. But to your point, like he's an American medical student. This is true across everyone. So, I completely agree.
Yes. And so, I think that sometimes the challenges that U.S. medical students face may be a little different from Caribbean medical students, but there's also a lot that's in common. And so some of the underlying issues are very similar or exactly the same. And so the approach should be very similar. But being able to learn, to teach yourself or to consistently properly read a vignette so that you distract the appropriate information is very important. Yeah. sometimes the students know enough knowledge that even without honing that skill, they do get some questions right. And they don't realize the importance of honing that skill in order to get more questions right.
Yeah, for sure. Yeah, it's sort of like what gets you here won't get you there. We find that sort of to get to a 240 level on step two, it takes mainly knowledge, like 230, 240. But to get to a 260, a lot of it is just interpretation.
Right.
Yeah.
The other thing is that early on in medical school, it is more rewarding for a student to be doing questions in a question bank that where the questions are relatively simple. They're not long vignettes, they're not very wordy. They're just trying to test, do you understand certain things? But as you progress and are getting closer to preparing for USMLE Step 1 or the Comprehensive Basic Science exam, you need to be exposed to longer vignettes and more complicated two-step questions or three-step questions, because those are going to be the questions that you kind of see. And long gone are the days where these questions have keywords that just jump out at you and signal, that's the right answer. And now they're describing the process or describing a physical finding rather than using keywords. And so it requires a little bit of critical thinking to get to the right answer and being able to put dots together, connect the dots in order to get to the right answer.
You are you are one of the few educators, again, that is not only taught sort of almost every sort of preclinical subject, but also have had extensive clinical experience. What kind of an effect has the fact that you've had so much clinical experience affected your teaching?
Yes. So, um, I can tell you that for many students, if you put a concept or even a fact in context of a medical situation, it's more interesting, they are more likely to remember it, and it helps to connect the dots. So as I teach, I will sometimes refer back to uh, a clinical case that I've had, a patient, and how the diagnosis or the treatment of that patient related to what is being taught that day or in that lecture or that topic. And it assists students, and they'll tell me, when I was taking the exam, I could hear your voice in my head saying, oh, this, or telling me about a particular student, you know? And so, case in point, in Haiti, often uh, unwanted pregnancies are treated locally by the pregnant woman drinking this tea made out of peanut skins, because the peanut skins are high in prostaglandins. And so that will induce uterine contractions and will expel the embryo, right? So now, it's not as good as some of the prostaglandins that are now available, like misoprostol, used in that, but the connection sticks with the students, right? And so now it becomes an interesting thing rather than just something that they had to memorize.
And I did not know that.
And so,
It,
as I teach this, if I introduce this kind of little anecdote, it helps connect the dots, and the students can appreciate it, and it sticks with them, so that now they can answer questions related to that. Whereas previously it would have just been one other thing that they just had to memorize that maybe they'd stuck, maybe it didn't stick.
wow, that's remarkable. I would imagine too that the what it is you're advocating of, making sense of concepts and, for the things that you can't make sense of, using tables to help you organize the information also helps a lot in when people make the transition to clinical practice, What's been your experience with that?
Yeah, so the transition to clinical practice is a multi-step process. It's not like you pass step one today and tomorrow, you are fully versed in how to deal with patients. There are multiple steps along the way and stumbles and errors that's the process. And that's why you're supervised by other doctors, all from interns, residents, attendings, to make sure that, as you're stumbling, you're not really putting everybody's life in danger. And sometimes, I have to say, sometimes students will learn something in the basic sciences. Okay? This is how it's taught, this is what it is. And then they go to the clinical sciences and they're like, what? It's done something completely different now? Like, this, what I was tested on, I was taught and tested on is no longer true or valid, and sometimes I get incensed by it, and I could see that happening, but it's true. I mean, it's a different beast when it gets to the clinicals. Some of the information there doesn't completely correlate with what is taught. And one of the worst things is that, I'm a pharmacology professor. I've been teaching pharmacology for probably better than 20 years. You right? The drugs that are taught in the basic sciences are all taught as generic drugs. But once you get to the clinicals, even as a clinical student, most of the physicians and nurses refer to the pharmaceutical name of the drug, right? And so now you've got to relearn the name of all these drugs to the name that's being used in the clinical sciences. And that's also frustrating. And you're like, oh, why didn't they use that? Well, there are reasons. But yeah, on standardized exams for step one, with very, very few exceptions, the drugs are going to be named as generic drugs. And in the clinical sciences, more than likely, you're going to be exposed to the pharmaceutical name, the brand name. And the same drug may have more than one brand name, right? So, like a nicotine has probably half a dozen brand names. It's Adalab, there's all of these names, but it would be too much to try to teach you that in the basic sciences. It's probably better to teach you the generic name, understand the mechanism of action and side effects, and then later on when you get to the clinicals, are you exposed to the pharmaceutical names for these various drugs. And different countries will have different drugs. Something as simple as acetaminophen, even the generic name is different, but it's called Tylenol in the United States, paracetamol in Canada or in some other countries. And so you need to learn all or be exposed to all different names of these drugs.
Yeah, I remember I had to buy Benadryl in France once, and it was so difficult to sort of explain. Like I had to, you know,
Yeah.
explain like an antihistamine, and then they eventually were like, "Oh, okay, yeah, this." So obviously, time, experience, those things will help. But what have you found to be the biggest accelerators of sort of that transition from preclinical to clinical?
Curiosity. Right? The decision or the conviction that when you are exposed to a patient, and yeah, you're not the only one that's responsible for examining the patient, but you're interested enough that when you go home that day, you pull out your, Harrison's textbook or whatever and look up the disease there, right? And don't rely solely on what was taught in pathology in the basic sciences, because there's a lot more that you need to know than just in the pathology of the disease. You need to know the clinical presentation, some of the challenges that they face, because now you're not only treating the disease, you're treating a human being that has the disease. And so there's a lot more involved in that process than just understanding the disease or knowing what drug is the drug of choice for treating that disease. There's a lot of different aspects. And so that you get from reading the clinically oriented textbooks, right? Harrison's textbooks or for surgery, right? And so those are kinds of what without that desire, because by the time you get home, you're tired. You've been there since 7 in the morning, or sometimes 6, as you have to drive a long way to get to the hospital. All you can think about is eating dinner and having to do it all over again the next day. You really need to have the curiosity and the convictions. Spend some time looking up these diseases, reading what's available, so that you could be a good doctor and be able to answer the questions on rounds from the next day. So that really is the key process.
Wow, that's really good advice. I mean, I'm hearing there's obviously the behavior of like, looking stuff up and trying to understand sort of the best treatments and reading textbooks and things like that. Obviously, those behaviors are going to drive sort of an accelerated transition from preclinical to clinical. But really, it's sort of the mindset or the curiosity behind it that sort of helps fuel that. Because if you really enjoy what it is that you're doing, then you're going to want to do it more and you're going to be able to sustain it over a longer period of time. Is that a fair?
Absolutely. Not everybody loves all aspects of medicine, and that is true for preclinical. There are students that love physiology but hate behavioral sciences, or love the anatomy but hate, epidemiology, right? Uh, you still have to learn it, and you still have to master it in order to do a fairly good job of passing the standardized exams, USMLE Step 1, and moving to the clinicals. But in the clinical sciences also, there are students that love surgery, but maybe they don't like OBGYN. You're like, well, isn't that kind of related? No. To them, it's different, right? Or maybe they like internal medicine, but really hate pediatrics, you know? And so they will have to overcome that dislike and apply themselves to learning those topics, despite the fact that it may not be what they really enjoy learning. And it's necessary for them to actually become doctors, because you can't, become a doctor with only knowing half of medicine, right? Yes, later on you can specialize and have a very narrow field that you are an expert at. But in general, to get through the process of becoming a doctor through medical school, you have to have a much broader understanding and appreciation of medicine, right? But sometimes that involves doing something you dislike just to get there. And you have to really sometimes convince yourself, to get through it and learn about it and look up stuff in textbooks, Sabiston or whatever textbook, just learn the material so that you can excel at it. And then later on, you don't have to continue doing the stuff that you find less interesting, right? And when you're doing your residency or fellowship, you can more or less specialize and avoid some of the stuff that may find less interesting but initially you really have to force yourself. And like everybody else, nobody likes to do things they don't like, and they all like to do things they do like, right? And so what I see is that when students are preparing for a step or preparing for the national boards, they love to go and review material that they love. So they love Path. They'll read all day long Path textbooks and watch Path videos and do Path questions, but they really don't like some other subject. And they will avoid it like the plague. They'll put it on the back burner. They're like, I'll get to that right before, which they never do. So they never actually have enough time to really review it adequately to master it. And it's like pulling teeth, you know? So the student has to overcome that dislike and maybe force themselves to learn that material first, with the reward being now you can review the material you do like because you've actually gone through the stuff you don't like, right? But it is something that a lot of students do. I see that in a lot of ways because, and it's natural. It's everybody's got stuff they like and stuff they don't like. It's natural to want to do that, but it will come back and bite you if you don't show some discipline and some structure when you are reviewing the materials for incorporation exams.
I'm just thinking about the earlier advice that you shared of, it's like if you're not seeing if you're seeing a gap between how hard you're preparing and what your scores are, right? If you don't know how to read questions, that can be like a huge motivation killer. And so also if you're just kind of memorizing things and not really understanding the concepts, also that can really kill your motivation. So it's all of these things really feed into each other. It's kind of what I'm getting. It's like you got to understand the concepts to sort of put it together. You need to be able to have the retention system to be able to remember it. You have to have the ability to apply it by knowing how to read and sort of dissect a clinical vignette. And if you do that, you're going to start to like things more. You're going to develop that confidence and that competence that will then make you like it more, and that it'll drive that curiosity that'll then make it easier to continue to do those things that were making you successful in the first place. Is that a
Yeah,
fair?
that's a fair. And more importantly, when you're talking about concepts, there's probably like 1,000 different ways you can ask the question to test the concept. And so if you try to memorize it instead of understand the concepts, that may allow you to answer 4 or 5 of the different ways out of that 1,000 ways. But the rest you're not going to be able to answer because you really didn't understand the concept, right? And so for concepts, it's really important for you to understand them because there's so many different ways that they can present themselves, that they can be presented on an exam. When it's something like glycogen storage disease, okay, there aren't too many ways. There's a few ways. Maybe you can ask about the enzyme rather than ask about the name of the disease, or ask about some of the other symptoms that the person would have to differentiate it from other like glycogen storage diseases. Maybe, but there aren't really like too many more ways that can present because that's not really. Yeah, it has some concept in there, but it's really something you have to memorize, right? Whereas feedback loops or blood pressure and heart rate or autonomic dysfunction, there's so many different ways that it can be presented, right? And if you memorize 1 or 2 ways, there's still so many ways that it can show up that you won't be able to answer. So being able to identify, first of all, is this a concept or is this something I had to memorize? And then going about treating those two things differently, right? You're not going to treat a concept the same way you treat something you have to memorize.
Speaking of sort of learning how certain things are presented and sort of memorizing very specific scenarios versus the like sort of the different ways that they can test it. Why do you think there's such a big gap between when people, because a lot of people can pass the comp, but then there's still a significant number that fail STEP. Why do you think there's that gap in performance?
Well, even though the NBME would like you to believe that they're the same exam, they're not really. They don't even say that they're the same. They don't even try to pass it all. What they say is, if you can pass the CBSE, then you have a very high chance, depending on your pass score, you have a very high chance of passing USMLE Step 1 because the concepts are the same, or a lot of the material is the same. But it's not really the same way that it presents, that the questions are presented. If you compare, the vignettes on the USMLE Step 1 are much longer, generally, than the way the questions are worded on the CBSE. There is also questions that are multimedia questions that are presented on step one that you don't see on the CBSE, right? There are some differences between the two exams. And if your preparation doesn't take into consideration these differences, you may be at a disadvantage. You may pass the CBSE, but still be at disadvantage for those step one. I also feel that, so the length of the exams or the length of the vignettes are usually much longer on the step one. The complexity of the questions, the two-step, three-step type of questions tend to show up more frequently. Even if the concept is the same, the fact that it's a multi-step question sometimes puts the student at a disadvantage. So there are, and also the length of the exam. Doing a 5-hour exam compared to a 7 or 8-hour exam, that is also because if you have not trained yourself to build up stamina as you're studying all along the way, by the end of any long exam, your ability to focus and answer questions with the same percentage of accuracy as you did in the beginning of the exam is different, right? So at the end of the USMLE step one, you're just like click, click, God take me out of my misery, click, because you have not properly built up the stamina necessary to be able to last a 7-hour exam and be able to answer and have the same level of focus at the end of the exam that you had in the first hour. Now, CBSEs are no joke either. You know, there are 200 questions, 5 hours or 4 and something hours, and do require the development of stamina in order to be able to last that long. But for the step one, it's even longer, right?
CBSE, is that 200 questions?
200 questions, yes. 200, there's a break, 20-minute break after the first 100. So the first 100 is about 2.5 hours, roughly. And then a 20-minute break, and then the second half is about 2.5 hours. So those are, so really, in those you have, basically, you have to last 2.5 hours with no break or very little break, right? And then you get a 20-minute break, and then you can reset your concentration for the second half. But for the step one, it's different. I mean, you're going on it for 4 hours, I believe, before you get a decent break. And then
I think it depends. That
there are
I
smaller
think
breaks
you
you
get
can
a
take.
choice.
There are smaller breaks you can take, but then that's a lunch break where you really can reset, reset your concentration. So yeah, even with the small breaks, you have to really use those to your advantage so that you are maximizing your ability to concentrate and answer questions as efficiently and as accurately throughout the entire exam. All right?
As we wrap up, I'm curious, what advice that is sort of counterintuitive or kind of goes against the grain have you found to be most helpful for students in preparing for the USMLEs?
One of the things that I tell my students is that, with very few exceptions, no student ever really feels completely ready to take the step. Right? They always have some lingering doubt in their mind that there's just some things that they just haven't covered enough, and they would just like maybe an extra week or an extra 2 weeks to cover, or on sometimes longer. But at some point, you need to take the exam, right? And if you wait too long, sometimes that works against you as well, because you cannot maintain that level of studying day in, day out, 12 hours a day, month after month, I mean, there comes a time where you start to get diminishing returns, right? And then you're no longer at your peak when you're actually sitting and taking the exam. So do you want to sit and take that exam when you are at your peak, right? And sometimes if you think, I need an extra month, I think I feel better with an extra month. And that extra month actually brings you down because you're not studying 10 hours a day, maybe you're only studying 7 hours a day or 6 hours a day. So you're forgetting more than you're actually adding extra. And you're no longer at your peak when you're actually sitting the that exam. And so that is something that is sort of very personal. And the student has to have enough self-insight to be able to recognize that they're falling into this trap, right? That they really need to take the exam soon because they've already peaked and now they're starting to head down, right? And but to make matters worse, you actually have to book it sometimes weeks or months ahead of time to know exactly when your peak. So you have to estimate when your peak is going to be so that you can book it and so that when you're actually taking the exam, you're at your peak. And it's a difficult thing. And a lot of students are in denial about their abilities and their progression. And so that can sometimes play a role in their performance, ultimately.
Any advice on knowing when someone's peak would be?
It's different for everybody. And some people have that insight, but a lot of students don't have that insight. You need to discuss it with some type of mentor or advisor in order to be able to identify that and properly plan so that they can maximize their scores.
Makes sense, yeah. Oftentimes we need someone else to sort of point out our blind spots. Thank you so much, Dr. Iliou. If people wanted to follow you or to sort of learn more about you, what would be the best way to follow you?
Um, well, I think I can give you some links and stuff. I will send those to you, and you can hoax them on.
Excellent. We're happy to share those in the show links as well.
Thank you very much.
Well, thank you so much for taking the time to speak with us and sharing your perspective.